We know PEI's budget is a sea of red ink. This week, we'll finally learn how the PC government intends to control spending while minimizing cuts. It's budget week on PEI. Today, we'll talk about what to expect in the budget or not expect, healthcare, political interference, and a new feature, Star of the Week. All that, plus a whole lot more. Let's get at it. This is episode 3 of Myers and MacNeill, because life is local. Stephen Myers, welcome to episode 3 of Because Life is Local podcast. Are we ever going to see a provincial budget?
I suspect one will come this week. I mean, the speech from the throne passed yesterday, and the Tories are into legislation, which is pretty light at best. So I don't think they'll have much choice but to bring a budget to the floor this week. So I imagine everybody's waiting with bated breath to see how bad the bad news is going to be.
What do you expect in the budget? Because here's what I'm thinking is Rob Latt's had a year to think about what he wants to do as premier. This legislative sitting, which should be the defining session for him, is uber light in terms of government legislation, as you already indicated. How do you sort of can make a connection with Islanders in a budget that requires both push and pull?
Yeah, I think that's going to be the tough part of it. I mean, government's kind of indicating that they need to make cuts. I guess that's true. I don't know. I don't have any intimate knowledge, but I would say the bureaucrats have wanted there to be cuts since 2019. So it's not surprising that they're finally going to get their own way here. I do think that there's a significant challenge that the government's going to have of who they cut, because the cost of living is really high. And I hear a lot of people complaining about the price of gas and the price of groceries, and the government has promised to tackle this as an issue, the cost of living. So I don't know how you cut things that are going to affect people's cost of living more and say that you're attacking the cost of living.
Well, one thing that'll affect people's cost of living is how much we pay to service our debt, which is right now $170 million or so. If we come in with, I think most people are anticipating a budget deficit for the fiscal year that's just ended of somewhere around $500 million. That will probably be higher in this coming budget, which means our debt service rating will increase, and our debt to GDP will increase, all of which nobody really cares about unless the bond rating agencies downgrade our rating as a province, which they've done in other places like Nova Scotia, which drives up the cost. That's the first amount of money off the top in any budget is debt service. Where's the happy medium?
I don't know where the happy medium is. I think that, people can't eat a balanced budget. As a good friend of mine who was in the Liberal caucus at the time when Wade balanced the budget told me, he said people in his district couldn't eat a balanced budget. I mean, you have to be putting the people first. I think that I'm not sure that I'll ask you, do you think that the people who run the finances of this province are adequate?
The people who run the finances.
Well, I'll give you an example. How many times does government promise that this is what the budget's going to be, and then it's not? I was part of 2 surplus or maybe 3 surplus budgets that were completely unexpected, that took everybody by surprise when it finally came out that, hey, we have $60 million left. How does that happen? How are you tracking throughout the year that your spending doesn't change so much that it puts you out of whack? And now we're seeing it on the other side of it, where we're not able to control.
Well, I think obviously some of our projections as a province in terms of revenue and expenditures has been woefully inadequate. I remember Jill Burridge referenced provincial salaries as one of the reasons why the budget so badly missed its projections. And you got to wonder, salaries are the highest cost in government, right?
In any business.
In any business. So how can you be so far off, especially even if you're using travel nurses? That's happened in the last 5 years, and that chart is like that. So we should have been anticipating that there would be a significant increase in those costs, but it seems like we didn't. I know healthcare is a big driver for it. We're paying doctors more, fair enough. We're paying nurses more, fair enough. We're paying everybody more, fair enough. But at some point in time, that bill has to be paid. And you talk about, you're not acting on the people's behalf when we deliver a balanced budget or whatever, or we cut. Well, you're really not acting in the children of the people's behalf when you don't actually try to bring some common sense middle ground to it. And look, the biggest item in a provincial budget, I think is more than 60%, is salaries for the public service. Public service has grown exponentially in the last 30 years with almost no checks or balances. When we do a provincial budget, we never go back and say, is this program working or not? Is this department needed or not? We go back and say, Stephen Myers in the Department of Transportation last year, you had a budget of $110 million. We'll give you a budget plus or minus 2 or 3%, right? That's how it works, basically.
Well, no, honestly, how it works is you have a status quo budget. So you have the things that you're locked into for the following year. It could be contract salaries. It could be, commitments that you've made to build things that you've already started. But my experience is I get hauled up in front of a bunch of people and they have decided what programs you're not going to have. It doesn't matter what your mandate is. It doesn't matter what your department's trying to do. My experience has been that anything but that. So it's way out of whack, I'll tell you, the way the budget is put together.
Let's talk about that. What do you mean by that? Who's doing that? The deputy, the directors?
No, not the deputy. No, like I would be, all of the times I've done it, I've had to go up with my staff and basically say, here's why we're trying to do this. And then when the budget comes out, it's like, yeah, we just decided you're not doing this. So then I got an answer to it.
So is that the finance department?
Yeah.
Okay. So that would be an example like in Nova Scotia where they cut cultural programs and that type of thing. And then there was a massive backlash right away. There's a challenge within the finance department because
You'll have to tell me.
Have they ever got the numbers right?
No. And here's a great example. You run a business. We run a business for a lot of years here. You don't wait until you get to your year end and say, geez, we missed it by a mile, or I didn't know all these salaries were going to put us so far in the red. So no business can run like that because you'd be out of business next month if you did that.
Well,
government just gets to go
they
on.
love to hide these things, right? I mean, and that's the political side of it. If it was a business, you'd be talking with all your managers in-house and you'd be coming up with a solution.
But I think there's politics inside politics because, like I said about the surplus that time, no one knew about it. And then all of a sudden, wham, it came in front of awesome. We're like, where did this even come from? Where did this even come from?
Do you expect, what type of cuts would you expect? I mean, look, there has to be some attrition with the public service somehow. Maybe that's buyouts. Maybe that's, you were not filling positions. But, and I'll argue it at both sides of my mouth. When you cut back public service or try to reduce public service that way, it's not an efficient nor an effective way to do it.
No. I'd say you should ask government how many people are left, took a buyout or went on their pension early and are on contract for government right now. You might be surprised.
It would be a lot.
Oh, there'd be a lot. So, I mean, it's only effective if the people that leave are the ones that you want to leave, not the ones that you need. And the ones that you need leave because they know you need them. And then all of a sudden they're like, hey, I'm paying you twice as much now and you're drawing your pension. And we're no further ahead. It's cost us more.
So are you saying that, how does Rob Lance create a win for Rob? Because he needs a win. Do you agree?
He's not going to create a win for himself out of the budget. I think here's the thing. And Wes Sheraton said it years ago, and it made me so mad at the time when I think back, because he said, we were debating the budget and he's like, well, the budget's just a document. Like it doesn't really mean anything. It's how we think it's going to be. And then it's the blue books that matter. And I was like, well, it can't be like that. But it is. He was 100% right. It's the blue books that matter. Like this is a political document at best because, you look at special warrants, everyone knows going into this that you're going to need a special warrant for things. Like paving is one that's a special warrant for every year. Everybody knows this because you're not going to leave the roads unpaved. And I know at one point, some of the programs that I had were like, that's just not going to fund this program. Like this is not going to work for the program. And I was basically told, go get a special warrant when you run out then. So like, it's a political document because they're trying to make it look like something to the public today. The only one that matters is the blue books. Like, what did you do?
So to explain for the listeners who may not know, what are the blue books?
So they're the audited financial statements. It's what the money is spent on the programs, and it gives you the true picture of what you had for a financial outcome. So did you have a surplus? So when I talked about the surplus that we didn't know we had, it was when the blue books were coming to be published that we found out.
But the problem with that is, I mean, we didn't get a full fiscal update until December? Yeah. After the house closed,
Yeah.
So, and that doesn't even count. We won't even come close to closing the books for last year for months, probably. So
That's an issue. I
the
mean,
blue books are important,
they're
but they're a historical document, not a how do we govern today document.
100%. I mean, but this is the problem with government financing. This is that there's going to be a budget this week, and we're going to talk about it next week. We're going to say, here's what was good and here's what was bad. It's going to be political fodder. It's going to be part of all question period, and we're going to get all kinds of information out of it. But the truth of it is, it's the blue books that determine what you actually did, because there'll be things in there that weren't budgeted for, and there'll be things that were budgeted for that didn't happen, and people will be like, well, why didn't you spend this? You were given the money from the legislature. So
Let's transition to the biggest cost in the budget, since we're talking about it, which is the biggest department, which is health,
yeah,
more than $1 billion. PEI we're really challenged. And I talk all the time about politicians should not be meddling in healthcare, which politicians do. But I can also make a case why we can't take politicians out of healthcare until health PEI builds trust with islanders, which I don't think they have. And the example would be the manners and the recreational programs, and saying we're going to put long-term care beds in those recreational areas to try to free up some of the space. It's a really important issue that health PEI is trying to tackle. I don't know how many times I've heard Dr. Trevor Janes go on TV and say it's not an ER problem. It's a problem of our ability to deal with the people who need to be in hospital beds. And, you can go to Kings County Memorial, 50% of beds are long-term care right now?
yep,
Something like that. It's a huge number. So it's a huge issue. But in Surrey, in particular, local MLA, Minister of Education, Robin Croucher, along with the Minister of Health, Corey Deagle, they pushed back on health PEI strongly, to the point where they're not going to be putting long-term care beds in the recreational area of Colville. That's political interference, but it's probably political interference on the right side of the ledger.
yeah.
I don't blame health PEI for trying to come up with a solution. That's why we pay them. I think where the problem comes in is that their solution didn't really recognize the reality of those facilities, nor the potential impact it can have on our seniors. So how do you find a middle ground, Stuart?
Well, I don't think you find a middle ground, because I mean, I would be the last person on earth who would ever probably defend the health system, but they're being probably told by government you don't have any money. They're probably being told, well, you can't spend any extra money on things. So they're like, we have to use what we have. So this was a solution they came up with. It's not a good solution, and it's been recognized and rectified. So they have political pressures on both sides. So they have the political pressure by somebody saying you can't spend any more money, and then the political pressures that Robin and Corey put on them last week, that it's like, no, you can't do this. I'll give you another example. The walk-in clinic here in Montague was never going to be a thing. Health PI did not want it.
Right.
Corey Deagle drug it for a long time. I was involved when there had to be a fight, unfortunately, but was one of my marquee moves. Darlene Compton was involved. If it wasn't for, we took it to the premier. It was in the premier's office a number of different times, and finally, at the end of the day, Health PEI let it happen. Would never be a walk-in clinic in Montague if there wasn't political interference.
I don't disagree with that at all. I mean, I think the other challenge we've seen on the healthcare file in the last couple of weeks is Dr. Malone from Surrey, and his very unfortunate personal reality and his attempt to move his fee-for-service practice to Charlottetown. And he was quite forceful in saying he wants to move to work at the UPEI medical home. And the challenge with that is the healthcare bureaucracy in this province has decided that fee-for-service is going to be the dominant way to pay physicians, which is a huge challenge why we have 35,000 people on the patient registry, because over the last 10 or 15 years, there's been a transition from complete fee-for-service, basically, to 90% salary. And the patient panels are smaller than they were when you and I were growing up. That's not an indictment of a current doctor. Doctors deserve to balance of life.
100%.
But the reality is, if we want to eliminate 35,000 patients on the patient registry, we need to hire X number of new doctors, maintain all the 103 GPs we have, and have them take on 1,500 to 2,000 patients each. That's not going to happen in PEI.
No, I mean, it's changing times. I think I had Dr. Colburn back here when I was all right up until he passed away. And you could get in to see Dr. Colburn anytime. Like he would take you and make sure he saw you, but he didn't get to live very long either. So I think that if some of these young doctors come in, and I agree with them, there has to be a proper balance between your life and what you do for your work. And they could work 7 days a week if they want to, but I can completely understand why they don't want to. The panel size impacts that because you can only take on so many patients when you want to work regular normal hours like a normal person does. And there is a really tough balance. I wonder sometimes if when we had opportunity to bring lots of doctors in and have less patients if all of the parts that needed to be agreeable were agreeable. So I often wondered were there people that stood in the way outside of the government realm that kept there from being more billing numbers, for example.
Well, that was a big thing for a lot of years.
So when we could have been filling up on doctors, the group that maintains the licensing wouldn't allow it.
College of Physicians.
Yeah. So, I mean, I don't know. And now we're all paid for it today, Paul.
But here's back to Dr. Malone. Health PEI has come up with the notion that the medical home at UPEI is somehow going to be used as an attraction, a recruiter for GPs to come to PEI. And that's the justification for not allowing a fee-for-service doctor there. Does that make any sense to you?
I don't know, but only anecdotally from what I've heard is that there's tons of doctors trying to get in there now. So whatever it is, that's the lure of that, because they're there, they want to be able to teach and stuff too. It's what I'm being told. So
which Dr. Malone is doing.
Right. So I think there's an extra lure to the school that maybe no one knew would be there. Maybe they hoped would be there, but didn't expect it to play out quite as strongly as it has. So I don't think they're having any problem attracting people to go to UPI. They may be having trouble attracting doctors, but they have no problem finding somebody who wants to go in there already. So that might be part of the reason why they were less flexible.
I think Health PEI needs to understand, because they seem to have a significant mental block to this. It's fine to recruit a doctor. It's better to retain a doctor. And we're awful at retaining doctors. I don't know why. I mean, there used to be modest, not much, but there was a hybrid system that allowed sort of a doctor to work within a salary component, but also a fee for service. But again, it's the bureaucratic mindset that says fee for service is not the model we want to follow in this province. And I got to tell you, if you look at the data that's out there, the data says that access to a system, which is our biggest problem right now, is better under fee for service. Care with complex cases is better with salaries. So why don't we say why don't we come up with a blended model, for God's sake? Doesn't seem like rocket science.
Well, let's go back to the walk-in clinic care moniker. That was one of the issues. One of the issues was that the walk-in clinics fee for service, so doctors who work there get paid in a different scale than they do if they work in the ER. And Health PEI was concerned that they would drop their shifts in the ER and work there instead. And I'm like, this is foolish. Like, there's absolutely foolishness that I heard. So like, yeah, you and I can't change it. Well, the MLAs can't even change it. I think it's so far gone that I still think we need to blow up Health PEI and start over. But
I'd love to know what that model looks like.
Was the model we had before. Remember when the hospital was run by a local board, made local decisions, got doctors themselves, made them happy themselves? We always had doctors then.
There should be some local autonomy. I don't think going back to sort of 1975 is the right way to go.
Well, 84, take me there.
Well, that's still 42 years ago.
It is. It is.
I appreciate in PDI we have a fondness for what the past used to be like.
But I do think the past is better, Paul. Like, here's a great example, and I think of it the other day. I saw it was a clip of, we've all seen it, the Ronald Reagan and the Mondale debate where Ronald Reagan's age came up and he made a joke and he says, well, I'm not going to make age a factor in this election. I won't exploit my opponent's youth for political gain. And they laughed and they were all smiling like, man, we may have thought those times were terrible when we lived them, but it's a hell of a lot better than what we have today, where there seems to be so much hate spewed at each other that that we almost have dehumanized each other in the political sphere over it.
Well, yeah, I totally agree with that. And there's a whole bunch of reasons for that. Media is one, social media is one, general atmosphere around the globe is another. But also, too, the growth and size of provincial bureaucracies. And there's research to support this that bureaucracies often grow to support bureaucracies, not
Indeed.
not to improve services to you and I and everyone else.
Yeah, and sometimes when you make changes to systems or you try to bring in a new system, my experience has been the bureaucracy sometimes looks and says, well, how's this going to affect me? Like, what's this mean for me versus what's this mean for you? So what's this mean for the public or what's this mean for the greater good? It's like, will it make my job harder? Will it make my job disappear? And I mean, I get it. That's human nature to worry about those things. But when you're in a position in the public has to be put first. And I oftentimes wonder if they're put first enough.
I don't think they are. And I think we're sort of living in a time where we almost need to increase those conversations. I'm interested as a side conversation here. This notion of the 3, potentially 4 Atlantic provinces creating a nursing pool to sort of combat our addiction to travel nurses. Logistically, it'll be difficult to pull off. We can come up with sort of streamlining the rules and regulations and stuff like that. But the challenge with travel nurses today is, A, they're paid about double what an RN is paid, or significantly more. If we create a pool of the Atlantic provinces, we're still going to have to pay that group significantly more than the nurses in the system to incentivize them to do it. So I don't know whether the logic's there. Shouldn't the incentive be to get more people into the public system?
Maybe. I think here, just at the age I'm at, Paul, I think, I'll take it from the age that I'm at. And if you're at this age and you were a nurse and somebody said, well, here's an opportunity where you could work in PEI in June, and then you could be in Cape Breton for July, and then we'll have you over in Halifax in September. Doesn't sound terrible. Like if your kids are growing up and you have these, they might have an opportunity. It's like, I'm going to move around a little and I'll get to live in these different places. So I can see why people would be attracted into that model. And I know that the travel nurse thing is really expensive and it's a really hot button issue here for particularly nurses. I don't really have from anybody else, but if we could create a pool of our own that didn't cost as much, even if it costs more and it met the needs of our healthcare, it's probably not a terrible thing.
Well, I guess you'd have to run the numbers of how many nurses who live in the Maritimes and the Atlantic region are travel nurses. And if there's not a core that would be similar in size to a maritime government-led initiative, then we'll be sucking more nurses out of the public system, won't we?
Well, I guess the question is are nurses paid enough? And so if we're willing to pay them this much to travel in, or we're willing to pay them this much, and that might be the thing. If you pay them more, they stay. That was the approach with doctors, where you said, let's pay doctors more and they'll stay. Let's pay nurses more and they'll stay. Let's pay teachers more and they'll stay. Like, why are we so afraid to pay people?
Well, we did say doctors will pay you more, and then 63 signed a letter saying we don't trust you, provincial government, and a good chunk of them were ready to walk.
I didn't read the letter. Did it say provincial government or one person in particular?
I don't think it was one person in particular. It was Health PEI.
Okay. We don't know if that's government or not. Remember?
I know it's government because the minister's telling them what to do.
I had a question I want to ask you, and okay. It's a different topic. But so Robert Mitchell noticeably wasn't on the bench behind when Halifax, which I thought was great. It was perfect. He took my advice. Bill's in the mail.
You really think he listened?
Bill's in the mail. If I could just find the address to send it to, I guess. But the question and it's kind of rolling around my head a little bit is, government either has to go to an election or have a by-election. They may lose other people here yet. Like may be other people who leave, who knows. And government doesn't have to go to the polls until 2027 if they don't want to. So do they go to a by-election in September, or do they go to an election in September? And my thoughts are, I think if they go to a by-election, Robert Mitchell gets in the legislature probably. And is that a bad thing?
Well, I think it makes the Liberals' job a little bit tougher, because then it's easier to criticize Robert Mitchell for his own record, specifically on land, specifically in healthcare.
Totally agree.
It's an interesting thing, though, sometimes you got to be careful what you wish for, because if Robert Mitchell were to go and lose, then the Liberals might actually attract a better leader, a stronger leader, because I won't say the tide has turned on the Tories. I think the Tories can't, there is a path for them to win the next election, whenever it is.
Yeah.
But I think they are really on the precipice that it could go either way right now. I think there's a lot of distrust. I think there's a lot of anger. I think there's just a lot of frustration with the government and how they operate right now. And Rob Lance doesn't really seem to be doing anything to deal with the core issues that are impacting him as the public perceive his leadership capacity.
Yeah, I mean, I don't disagree with any of those things. I think that my personal opinion is government should have went to election a year ago, should have got a new leader right away. They had at least one person out. They ran Corey out of Dodge or stabbed him in the back, however you want to look at it. And
Both.
right, they did both. So I won't sugarcoat it. They stabbed him in the back 100% for sure. But that said, they should have went a year ago. Now they're in this weird spot. Like, Rob could lose the election if he goes in whatever it is 5 months from now. He could legitimately lose government 5 months from now. If he brings Robert Mitchell into the House, or if he allows there to be a by-election and Robert wins, I agree. Robert Mitchell suddenly has to answer for all his past transgressions. He took P&P. He was part of government that tried to close schools. He amalgamated areas that didn't want to be amalgamated. Well, you partially didn't want to be amalgamated anyways. And he fired the Health PEI board. Like, he had a whole life of politics before this, which would be no different if I went back. Like, if I went back 10 years from now, people are like, oh, look at all the stupid stuff that Myers did that didn't work out. And the other thing is, and I like Robert Mitchell, so he's a real good guy. So, and I don't mean this any more disparagingly than it's going to sound when I say it out loud anyways, but I'm not sure that he's going to be a tremendous performer in there when it's said and done. I spent a lot of time in the legislature with him. I wouldn't say he's no Robert Giz, he's no Dennis King. Like, I think the Tories should be smart to get him out in front talking.
Wade McLaughlin in terms of his strengths, right?
No, I agree. So if you give him hours and hours to talk instead of minutes and minutes is all he gets now, then it may be helpful to the Tories to say, oh, well, these are our choices now.
I don't disagree with that. I mean, I think that the Liberals have benefited from Islanders not really having a clue of what they stand for right now. And that's not going to go away. I don't think. It's interesting that the Greens haven't been able, but maybe if Robert were elected, that would be the thing that could start turning Islanders back towards the Greens.
I thought Matt had a better week this week.
He had a great week.
I thought he was better. He was looser, which was kind of what I was alluding to last week. He was looser about it, which I think
again, you're taking credit for
also the bills in the mail. Those guys will never pay by bill. But no, I thought Matt had a lot better. Listen. I think we should pick a star of the week, each one from the legislature. You go first.
White Stripes. I like Brendan Kern this week.
He's mine. You stole mine.
I liked him, and the lady with ALS from Somerville. Like, that was a very nice point. But B, he's a chirper.
Yeah.
Like, and I'm not sure that's a good thing, but it's an entertaining thing. And if you watch him, not when he's doing anything in the ledge, but when he's sitting there reacting to what's being said in the legislature, it's must-see TV, because he's got a death stare. He chokes himself off with his tie all the time. You could see the blood sort of rush up through his cheeks. You could see him talking to himself. I don't think any of those are reasons to promote him to cabinet like you've suggested, but I do think he brings sort of a youthful energy to the place, which is needed.
100%. He was the star of the. I probably would have picked him last week too. He's been the star so far of the legislature, in my opinion. He's getting some chances to ask questions. He's carrying himself well. He's driving Carolyn Simpson crazy. She stopped in mid-sentence a couple of times, and it had to have been him, because there's nobody else over there that would be probably chirping. So, and I mean, that stuff gets in your head too when you start stopping because people are chirping. It becomes a habit, and then all of a sudden, like, you can't power through it.
Yeah, the flip side of that is I don't mind chirping, but do it with some respect, right?
Yeah,
because
I love chirping. I think
well,
it's great.
I know, but if you're making a statement or asking a question on an important topic,
I don't disagree. There's times when it's not appropriate for sure.
correct,
Yeah,
correct. So
yeah.
okay, we just started a new thing, Star of the Week.
Start of the week this week, Brendan Curran. Your badge will be in the mail, Paul. We get it printed for you.
Steve Myers, that seems like a good episode 3.
That's good. I had fun.
It's a wrap.
All right.
Thank you.
See you next week.
I hope so.